Your heart is a muscular organ which lies in the centre of your chest. It pumps blood containing oxygen from the lungs to the body and passes blood without oxygen back to the lungs to absorb more oxygen. To do this effectively, your heart is divided into 4 compartments or chambers. There are 2 chambers on the right side of the heart and 2 on the left. A valve lies at the exit of each chamber. The valves ensure that blood flows in one direction only. The left atrium lies above the left ventricle. The 2 are separated by a valve called the mitral valve. The right atrium is above the right ventricle. These 2 chambers are separated by the tricuspid valve. The left atrium receives blood that contains oxygen from the lungs via the pulmonary veins. This blood then passes into the left ventricle, which pumps it into the aorta. From the aorta, the blood is passed to the different parts of the body. The right atrium receives blood with little oxygen from the body via the vena cava. This blood passes into the right ventricle, which pumps it into the pulmonary artery and back to the lungs to have oxygen added to it. The valve at the exit of the left ventricle, the aortic valve, stops blood passing back into the ventricle. The pulmonary valve at the exit of the right ventricle also stops blood flowing backwards. This flow of blood doesn't happen automatically. It's driven by contractions of the heart muscle, which are triggered by electrical impulses. A pacemaker in the upper part of the right atrium, called the sinoatrial node, sends electrical impulses across the atria that cause them to contract. The impulses reach the atrioventricular node, which is between the right atrium and ventricle, and pass onto the atrioventricular bundle, causing the ventricles to contract and send blood to the lungs and around the body. These electrical impulses spread across the heart muscle to ensure it contracts in the correct sequence. Nerves supplying the heart change the rate at which impulses are sent across the heart muscle to meet the needs of the body. Together, the chambers, valves, vessels and electrical impulses enable blood to be pumped around the body effectively so you get the oxygen you need.
Every examination of the heart begins by inspecting the thorax. Thoracic asymmetries must be noted. The chest may sometimes show a bulge over the heart which indicates cardiomegaly.
During palpation, the first thing to locate is the point of maximum impulse, which is normally found in the left medioclavicular line. In babies and young children, the point of maximum impulse is in the 4th intercostal space. In older children, it is between the 4th and 5th intercostal space.
During palpation, assess if the maximum impulse is raised or widened or too far to the left. These findings would indicate left ventricular hypertrophy. A raise on the lower left sternal border may indicate right ventricular hyperactivity and hypertrophy.
Sometimes a palpable cardiac thrill indicates circulatory pathology. The thrill should also be sought in the suprasternal notch. With young children, cardiac percussion is hardly ever performed.
The heart is auscultated in the following order: 2nd, right and left intercostal space; 3rd, left intercostal space, Erb's point; 4th, left intercostal space, lower left sternum border, as well as over the heart apex, and in special cases, the 4th, right intercostal space.
This illustration shows the relationship between the points of auscultation, the skeleton, and the heart valves. Murmurs which originate in the pulmonary valve can best be heard in the second left intercostal space. Murmurs radiate from the aortic valve via the aortic arch to the second right intercostal space. Murmurs of mitral origin can be heard at Erb's point and at the heart apex. A ventricular septal defect can be heard best at the lower left sternum border and at Erb's point. Murmurs which originate at the tricuspid valve radiate parasternally to the lower right sternal border.
During auscultation, note the following points: heart rate, rhythm, that is, the regularity of the heartbeat, quality of the heart sounds, and the presence of additional heart sounds, murmurs or clicks. The heart rate changes with age. In the first year of life, the heart rate is about 140 beats per minute. In the second year, 120. In the fourth, 100. In the eighth, 90. Towards the end of puberty, the heart rate approaches that of an adult.
When listening to heart sounds, we note their intensity, possible splitting, whether there are additional sounds in the form of a third or fourth heart sound, and clicks. Murmurs can be diastolic or systolic. Can you hear this holosystolic murmur? In addition to the duration of a murmur, we also judge its loudness on a scale of 1 to 6. We further describe the quality of the murmur, that is, whether it is soft or rough, the point of maximum intensity, as well as possible radiation to other areas, especially the back and the carotid arteries.
Common heart conditions. Coronary artery disease. Coronary artery disease occurs when the coronary arteries are narrowed or blocked, reducing the amount of oxygen delivered to the heart. Two conditions, atherosclerosis and arteriosclerosis, commonly cause the narrowing or blockage of arteries. Atherosclerosis is a buildup of fatty deposits on the inner walls of arteries. This buildup causes a narrowing of the inner vessel diameter, restricting blood flow. Fats and other particles combine to form plaque. Arteriosclerosis is a stiffening or hardening of the artery wall resulting from calcium deposits. Often called hardening of the arteries, this condition causes the loss of elasticity, changing blood flow and increasing blood pressure. These conditions can facilitate rough surfaces, making them vulnerable to blockages. A large thrombus can cause an occlusion, or it may break loose to become an embolism and form blockages elsewhere. When blockage occurs, tissues may die, and in certain cases, this can be fatal. Acute myocardial infarction. Acute myocardial infarction occurs when a portion of the myocardium, heart muscle, dies as a result of oxygen starvation. The dead area can no longer pump. This can lead to cardiac arrest, shock, pulmonary edema, or congestive heart failure. In some cases, heart attack patients suffer cardiac rupture as the dead tissue area of the heart muscle bursts open. Medications called thrombolytics dissolve clots that block coronary arteries. Other patients receive an angioplasty, a balloon device to open the arteries. Aneurysms. Weak spots that dilate are known as aneurysms. When a weakened artery bursts, rapid internal bleeding occurs and tissues beyond the rupture can be damaged. A rupture of an artery within the brain can result in a severe stroke. If a major artery ruptures, death from shock can occur. Arrhythmia. A malfunction of the heart's electrical system will generally result in an arrhythmia. Electrical disturbances within the heart result in arrhythmias, including bradycardia, abnormally slow, less than 60 beats per minute, tachycardia, greater than 100 beats per minute, or rhythms that are present when there is no pulse, including ventricular fibrillation, ventricular tachycardia, pulseless electrical activity, and asystole. Congestive heart failure, CHF. Congestive heart failure, CHF, is a condition of excessive fluid buildup in the lungs and other organs because of inadequate pumping of the heart or of failure of the lungs to function properly. Congestive heart failure can be caused by diseased heart valves, hypertension, or some form of obstructive pulmonary disease. The symptoms of CHF may include tachycardia, shortness of breath, elevated blood pressure, cyanosis, profuse sweating, cool and clammy skin, pulmonary edema, pedal edema, or the coughing up of frothy white or pink sputum. Late signs include engorged pulsating neck veins or enlarged liver and spleen with abdominal distension.
A healthy heart, as seen here, beats approximately 60 to 100 times a minute, providing oxygen-rich blood to the rest of the body. The lower left chamber of the heart, called the left ventricle, is the main pumping chamber. There are many different conditions that can lead to congestive heart failure, including a prior heart attack, high blood pressure, and coronary artery disease. Any of these can prevent the heart from efficiently pumping blood to the rest of the body. As a result, the heart may beat faster, and the ventricle may increase in size, becoming an even less effective pump. When the kidneys sense the reduced blood flow, they attempt to compensate by retaining more water and salt. This excess fluid retention often causes congestion in the tissues and results in swelling and an increased strain on an already weak heart. The progressive effect of the heart failing to properly circulate blood and congestion due to fluid retention is known as congestive heart failure.
In left-sided cardiac failure, when the heart starts to fail, blood stasis within the lungs resulting in pulmonary edema, and this leads to congestion and associated symptoms. It is more difficult for the airways to expand as one inhales, and breathing becomes difficult. One may feel short of breath, particularly with activity or lying down. In right cardiac failure, when the right side of the heart starts to fail, sufficient blood does not return back to the heart. Fluid collects in the feet and lower legs, resulting in pitting edema. As the failure worsens, ascites develops. Weight gain accompanies the fluid retention, and this is an excellent measure of how much fluid is being retained. Edema is a sign of right heart failure, especially pitting edema. Non-pitting edema is not caused by heart failure. So, to summarize, left-sided cardiac failure results in pulmonary condition, right-sided cardiac failure results in pitting edema, ascites, and fluid retention. We shall have an overview in this diagram. In left-sided cardiac failure, pulmonary edema develops. In right-sided cardiac failure, fluid retention, ascites, and pitting edema develops.